Welcome to TCNtalks. The goal of our podcast is to provide concise and relevant information for busy hospice and palliative care leaders and staff. We understand your busy schedules and believe that brevity signals respect. And now, here's our host, Chris Comeaux.
Well, hello, and welcome to TCN Talks. This is my favorite time of the month when I have my good friend Mark Cohen back. Welcome back, Mark.
Be here as always. Thank you.
This is one of our last shows of actually 2023, which is kind of crazy. And Mark, this has been such a joy. I actually got the vision of this show when I was going out for a walk for Christmas last year. And I thought, wouldn't it be cool to do a show that would be a service to hospice and palliative care leaders and staff? And in one show, in about a 45-minute listen, they could kind of hear what are the top news stories of the month. So they, as a leader, got the need to know to be able to navigate where things are going in the future. And you and I have had the joy doing it this year. We've learned a ton. One of the cool things that's kind of evolved, instead of me asking you, what do they need to know about you, because they know a ton about you by now, is you're just, you remind me of some of my cool mentors, Mark, and you really have become that for me. I feel like I seek out human Yodas, so hopefully you take that as the compliment that it is.
Yeah, I do. Thank you.
And so kind of the masterclass portion, and man, you've been bringing it the last couple months. So I wanted to cue you up to start this month. What do you have for a masterclass for our listeners?
Well, as a writer, public relations practitioner, and a journalist by training, for me, Hospice Month is a frustrating time. And that's because there is so little to say that hasn't been said 1,000 times before. For example, a news release or an op-ed column from a hospice provider that begins, "November is Hospice Month." That is simply not a lead sentence anyone should be proud of. It says nothing, and more importantly, it does nothing to draw the reader into the news release or the op-ed column. Ask yourself, why should anyone in the general population care that November is Hospice Month? They don't. They won't. In fact, here's a simple rule to follow when writing news releases and op-ed columns. In anything you write for publication, whether that's a news release, a column, or social media, if the verb in your lead sentence is, you might as well stop writing because nobody's going to read. You need an action verb. So how would that translate to Hospice Month? Well, instead of writing November is Hospice Month, how about writing November's Hospice Month celebrates providers like ABC Hospice, which was among the U.S. hospices that in 2022 cared for more than 1.7 million people in their final hours, days, weeks, and months. Or ABC Hospice is commemorating National Hospice Month by launching a new volunteer-driven program to care for the pets of our hospice patients when those patients are no longer able to care for their pets. Or a third option, anyone can contribute to the success of November's Hospice Month at ABC Hospice by shopping at our fabulous thrift store, donating new and gently used items, or learning about how to become a thrift store volunteer. Now, granted, none of those lead sentences are Pulitzer Prize winners, but they have action verbs, they draw people in, and they actually say something. It might not be the most exciting thing in the world, but it's a different way to talk about Hospice Month in November. And as I've said before, if you don't have an experienced writer on your staff, and many hospices no longer do, try to find someone in your community who can write and who is willing to work with and mentor your staff person tasked with writing your releases and your social media posts. So that's a masterclass for this month, Chris. A little harsh on some of the stuff I see every day in November, but I think it's important to point that out.
Yeah, well, and maybe not that Mark doesn't need defense for himself, but Mark has got so much amazing knowledge and gifts, and we live at a time because of social media. Anybody can post anything. And Mark has spent his life using words to tell stories and make an impact. And Mark, you've been a blessing to me. Recently, I've released my very first book, The Anatomy of Leadership. And you looked at it was actually a later draft And I feel like you took me behind the woodshed in a good way. And when I got over myself, I realized you were really making a difference. And at the end, the book became a much better product because of you. And I think that's what I want people to know is that, and you are kind of a dying breed because of, as you pointed out many times, we don't have people of your expertise, certainly not in our hospice and palliative care programs much anymore. And then because of social media, there are a lot of people post a lot of stuff, but it doesn't mean that they're gifted in the way that you are. So just want to call that out.
Well, I appreciate that. And I appreciate having the advanced look at your book. It was a fun read. It was a learning read. And if I contributed to making it a little better, I'm happy and pleased to have done that. But it certainly is a worthwhile read, not just, frankly, for CEOs, but anybody who is or aspires to a management position in the post-acute world. And I hope folks take a look at the book and maybe purchase a copy for themselves or for their staff.
I appreciate that shout out. Well, Mark, let's jump in, man. What's your top news stories of the month?
Well, between the usual and customary drop-off in all but breaking news around the Thanksgiving holiday, and with the proliferation of nothing burger news releases and op-ed columns ostensibly about Hospice Month, November was mostly unexceptional for news coverage, Chris. The exception to the unexceptional, of course, and it was a hugely impactful exception, was the ongoing coverage of the hospice journey of Jimmy Carter and then Rosalind Carter. While I only ran 9 distinct articles and columns in Hospice News Today about the Carters, there were many more general news updates on the Carters, particularly when it was announced in late November that Rosalind, too, had been admitted to hospice. Each of those articles ran in scores, if not hundreds, of news sources. So as I said, the impact and the exposure were huge. But in terms of the top 10 stories of the month, the list evolved a little from previous months, but was largely what you would expect. Number 1, long-term care and assisted living and senior living news. Number 2, mergers and acquisition news. M&A news. Number 3, general hospice provider news. Number 4, general hospice news. 5th place, end-of-life care and palliative care news. 6th place, hospital news. 7th place, labor and employment news. 8th place, we honor veterans and veterans program news. Number 9, for-profit provider news. And number 10, fundraising and development news. So going to the list, I ran 55 articles about long-term care, nursing homes, senior living, and assisted living in November in Hospice News Today. That's a decline from previous months, which I think mostly reflects the lost week of coverage due to Thanksgiving. The unfunded mandate, as it's being called by some, of the proposed minimum staffing requirements from CMS for nursing homes dominated the coverage, specifically with pushback from nursing homes, nursing home trade associations, and politicians against the mandate. A typical headline, for example, staffing mandate would smother nursing homes. Those stories were juxtaposed with a number of articles about substandard care being found in nursing homes in various states across the country. Although few of the articles on either of those issues seem to tie the two together. And on another related note, we continued to see coverage of individual nursing home closures and an ever slightly growing awareness of the ever-expanding nursing home deserts across rural America, parts of rural America. There were 42 articles on mergers and acquisitions all across the post-acute continuum and the acute continuum. In the hospice sector, these were mostly one-off acquisitions by for-profit providers, although the biggest news was probably generated by the pending combination of By the Bay Health and Mission Hospice in California, which then added Hope Hospice, also in the Bay Area, to the marriage in an article that I actually ran in Hospice News Today on December 1. Hospice Provider News was in 3rd place with 36 articles in November in Hospice News Today. As in recent months, the greatest number of articles concern the opening, reopening, closing, and renovation of hospice inpatient units. A subset of that were articles about the opening of several comfort homes, not tied to any specific hospice provider. And two not-for-profit hospices in Virginia announced in November that they either rebranded or refreshed their brands, making that 4 or 5, I think, that have done so in the last year or two in the Commonwealth. So Virginia, in that regard, is becoming an interesting market to keep an eye on. In fourth place, General Hospice News, which also saw 36 articles in Hospice News Today last month. The most significant news from a public policy standpoint was the announcement early in the month that Oregon Democratic Congressman Earl Blumenauer, one of hospice's most consistent champions in Congress over more than 2 decades, would not seek re-election in 2024. Regardless of your personal politics, if you care about hospice, you'll agree that Representative Blumenauer will be missed. And it's worth noting that in recent years, he's worked closely on hospice legislation with the Texas Republican, Beth Van Dunn, proving that hospice, after more than 40 years on Capitol Hill, can still generate some bipartisan cooperation and support. Also in Hospice News, General Hospice News, updates on the pending merger of NHPCO and NAHC scored several articles in November. And with regards to General Hospice News, it's important to keep in mind that I don't run your standard Hospice Month news releases and op-eds in Hospice News Today, given that they're almost entirely Hospice 101 and Hospice facts, myths and facts articles. So those hits are not counted either in General Hospice News or Hospice Provider News. Fifth place, End-of-Life Care, Palliative Care News, also again with 36 articles in Hospice News Today last month. This category included a couple of substantive articles about how to have advanced care planning conversations, which obviously were generated by Hospice Month, but they were well done and they were unique a little bit in their approach. A couple of research studies on palliative care earned coverage by trade publications, which is always nice to see on the clinical side. And death doulas continued to earn coverage in their local markets. And what now seems to be an every other month phenomenon, this month the death doula coverage did not take any gratuitous shots at hospice care. Hospital News also tied with General Hospice News and End-of-Life Care News with 36 articles in November. It almost seems like the hospital sector has decided to go toe-to-toe with nursing homes to see which sector can generate more negative coverage in a given month. This month's hospital, not something you want to aspire to.
No.
This month's hospital news was about layoffs and consolidation of executive positions, as well as continued losses by providers, both large and small. If they are funded by local bonding authorities, they have to release their earnings on a quarterly basis the way for-profit publicly traded companies do. And it was not pretty coverage again this month. It, of course, wouldn't be a month of hospital news if somebody wasn't investigating one of the large hospital systems in your neck of the woods, Chris. In this case, in November, it was the Tennessee Attorney General who's going after Ballad Health, which serves the Appalachian regions of North Carolina, Virginia, Kentucky, and Tennessee, although I don't think they quite bump into much of the service area for your Teleos collaborative network.
No, but a couple of my team members live in their service area, so it really did start in that eastern Tennessee area.
Yep. Labor and employment news was in 7th place. There was a significant drop-off in labor and employment news in November, only 25 articles. News about strikes far outpaced news of new union organizing efforts. I don't know whether that's a positive or a negative for the healthcare sector, but there were an awful lot of work stoppages in the news, even with the lower clip count. And this headline demonstrates, I think, why even healthcare executives in right-to-work states ought to be scanning labor and employment news across the sector. The headline read, Labor Department targets facilities in Southeast for wage violations. Something I don't think anybody wants to see happen. With this being November, there were 23 articles about veterans and hospice care and in Hospice News Today. Most of the coverage involved pinning ceremonies under the auspices of We Honor Veterans. My editorial guideline for Hospice News Today is simple. If a provider pins a veteran, if the provider is a hospice patient, And if there's a news article, I'll run it in Hospice News Today because I think it's important that people see that Hospice News Today readers see that other providers are generating local coverage for their pinning ceremonies. Well, while 23 articles is a nice number, for a month with Veterans Day or Memorial Day in it, it feels a bit light, frankly. For-profit provider news came in ninth with 22 articles last month. The vast majority of that coverage involved the quarterly earnings releases from publicly traded companies and then the subsequent conference calls that they conduct with financial analysts. And to counter that, in 10th place, there were 21 articles about fundraising and development news in November. It was your typical assemblage of news about grants received and events held. Couple interesting articles, though. One provider, Haven Hospice in North Central Florida, used Hospice Month as the news peg on which to hang a general news article about how shopping at, donating to, or volunteering for their thrift stores is a great way to give back and support local quality of life and be supportive of Hospice Month. Certainly an innovative approach. There was also a small not-for-profit hospice in Texas that took advantage of their local Giving Tuesday to give away coffee and donuts to anyone who came by as a way for this hospice to say thanks for the support that it received for a recent capital campaign. Kudos to those who look for out of the ordinary ways to promote local giving. My honorable mentions with not quite enough oomph to make the top 10 included physician and nursing news, home health and private duty news, physician-assisted suicide and medical aid in dying, Medicare and Medicaid news, pharmacy and medication news, and grief and bereavement news. I think the most notable category here is pharmacy and medication for two reasons. First, the growing coverage of psychedelics. The more coverage psychedelics get, the more likely your admissions nurses, care team members, physician leaders will be asked about your policy about this. So my recommendation as a public relations practitioner, best to be prepared with a statement before the question is first asked. And the second reason this category stands out is a continuing focus on pharmacy deserts across broad swaths of rural America. If I were a hospice provider, I would be engaging with my pharmacy benefit manager now to see how they are adapting to this growing issue. Also notable among the honorable mentions, frankly, is the relative lack of coverage of home health and private duty news. Only 17 articles in a month that's called National Hospice and Home Health Month. Better than the negative coverage that hospitals and skilled nursing got, but a significant deficiency, I think. Finally, Chris, also worth noting are a couple of categories that saw little coverage in November. We're into the holiday season, yet I only ran 9 articles about hospices doing wish and dream fulfillment for patients. That's a little light. On the positive side of sparse coverage, I ran only 6 articles about healthcare fraud and abuse. The second month where that number has been comparatively low. And also low for the month, believe it or not, I ran only 3 articles about medical marijuana, which reflects the fact that legislative work in the states is mostly shut down for the year. Thanks in part to the work that Rosalind Carter did in the last decade or so of her life, focusing on caregivers, there were a relatively large number of articles on caregiver burdens last month, 9. The best headline in that bunch, caring for aging parents doesn't have to be this hard. And as per usual, there were only a handful, 5, articles on governance, transparency, not-for-profit status, charity care, and executive compensation. They weren't good news for the not-for-profit sector. The most damning headline, as hospital expenses rise, charity care spending falls. And that's worth noting for the hospice sector, for the not-for-profit hospice sector. When your charity care is about 1% of your budget, and when hospitals are now being attacked because their charity care spending has fallen to about 1% of their budget, hospices need to really think hard about whether they want to center their mission fulfillment messaging on providing charity care. That's my take on November, Chris. What was your take on November from the C-suite?
Yeah, before I jump in, Mark, there's a couple of things I just want to mirror back to you. It feels like looking at nursing homes, pharmacies, and hospitals, and maybe even to frame my comment, think of the bell-shaped curve. Our mutual good friend Peter Benjamin always talks about jumping the S-curve. Hospitals, pharmacies, and nursing homes, there's no doubt they're on the right side of the curve, and I believe they're further down than hospice is today. Hence my comment. It feels like a cautionary tale for us when you look what's happening to them, which is why this show is so important. How do we make sure we don't bind ourselves there, that the hospitals, nursing homes, and pharmacies? Would you agree with that, or would you push back?
Absolutely. I mean, that's why you do issues management. That's why you do the scanning that I do. And, you need to, there are certain markets that are the forerunners of problems. If the issue is labor issues and unions, you almost always want to look at what's going on in California, because if it'll happen in California or Oregon, Washington State before it happens anywhere else. That doesn't mean you don't pay attention to it because it's not happening in your state. That means you pay attention to it because it might be coming to your state in the next several years. So issues management is what I've done my whole career, and what I'll continue to do even when I stop publishing hospice news today and working with my communications consulting clients. Vitally important. It's not a skill that's ingrained in a lot of hospice senior leaders.
Yep, that's well said. Well, as I go into mine, Mark, I kind of reflect, I guess it's the end of the year, so I'm kind of in a reflective mode here. And this is technically our last show. We'll talk about at the very end with you actually producing hospice news today. You just did a release today, so I'll give you a little airtime at the end to talk about that. But maybe I'm finally getting competent at this. And what I'm starting to see is thematically, or at least I have my themes each month, and now they're becoming consistent. And then I'm kind of putting the volume of the articles in these themes. And so the first theme, I'll just call it the mission moment theme. And this is where the Carters have been just an amazing gift to our industry. For years, we've been trying to help people understand hospice is not just about death. The death is one part. It's just one event in this journey, in this care model, where we really can't add life to days. Maybe your last days, your last months, hopefully last months. And then, of course, Rosalind Carter, and as you were talking about her caregiver work. So that was my first category. It looks like I've got about 7 articles in there, but I also grouped one additional article. Mark, I don't know how much you follow social media, but Nurse Julie has become she's got millions of followers, and she's doing some very bold, I will call it even edgy things that I've learned now 28 years in this industry, and like, what does death look like towards the end? She's putting this on video and social media. And so the article was, this hospice nurse is educating people about the actively dying phase of death. And here's the key, to me, it's the punchline, to alleviate people's fears. I mean, I remember years ago when we were doing a lot of analysis of the patient satisfaction, knowing what to expect, because death is not something people have generally done multiple times in their life. And so I put that in that category. I actually called Nurse Julie when she was before she had millions of followers, and asked her if she'd be on our podcast. And then next thing I know, she started her own podcast, which was super cool. And she actually now has a retreat in Western North Carolina that she recently conducted. But I wanted to call that one out because that's kind of what I would call under kind of the mission moment category. And the next category, which I feel like is going to be certainly the rest of my career, and I plan on working still quite a while, is just the whole staffing challenge, workforce challenge, staffing challenge. And now I've started to like sub-stratify it into like 3 categories. First category is articles that are basically painting the picture of the challenge. And there were several here. A Fox News article, a quarter of U.S. medical students are considering quitting school, and most may not even treat patients. When you look at the volume of the silver tsunami of the baby boomers, the math just doesn't work for the number of people. Now, there could be some interesting things. If Elon Musk has the trucks driving themselves, what's going to happen with all the truck drivers? Maybe those are going to be some of our future healthcare workers. But if you just look at some of the math, this is why the staffing shortage, and why I think, Mark, we're seeing which is my next category, what are the implications of the shortage? So I think I had 5 articles just painting the picture of the shortage. A USA Today article, why do nurses suffer from burnout, forced overtime, understaffing, and workplace violence? It feels like the shortage is exacerbating in some pretty ugly ways, which is then the next category, the implications. So I certainly have never seen the level of unionization and strikes in healthcare. And so Becker's or Nurses at Ascension vote to unionize, hospitals in Providence, hospital nurses set to strike, HCA workers strike at 3 hospitals in California. So to me, this is the implications of the fact that there are just not enough people. Now, luckily, and I only start to see this about mid-year, there's starting to be a third sub-strategy or subcategory of potential solutions. I had about 6 articles in that category. So this one, Mass General Brigham Hospital workers to receive average 21% raises, which has got to be pretty tough because that hospital is not getting 21% increase in its revenue. So that's coming from somewhere. You push the balloon pops out somewhere else. Home health sector improving turnover rate, continues increasing compensation. This one, Hospice News, breaking down costs, return on investment of hospice death doula partnerships. And I put that under solutions. We've been talking about this in our TCN network, Mark. There may be disciplines that do not exist in the interdisciplinary team today, like maybe paramedicine, maybe death doulas, maybe community health workers that we're going to have to figure out how to weave that into the IDG because there's just not going to be enough nurses, even if you have the best place to work, which of course we encourage a lot of people we work with. This next one, home health salary survey, lower turnover and widespread sign-on bonuses. So that's part of their solution, which my early mentor, who you know, Mark, my first CEO in hospice, always said the death nail of an organization is when they start to have to pay people bonuses to come to work for them. And the day and time when I was seeing that was mostly in the long-term care area. And then there was an interesting article about the first 90 days, what a medicine would be out of change to retain new hires and really working hard on that first impression in the first 90 days. So that was my second category and will continue to be as a staffing challenge. Now, right after that one, I just feel like I have to highlight this because I feel like it's so wrong-headed, but the whole staffing mandate in the nursing homes, and there are 1, 2, 3, 4, 5, 6, just about 7, 8 articles about the staffing mandate is not the solution. And God bless their heart is a Southern term, bless the heart of our legislators, because mandating a staffing solution would be like me saying, well, I'm just going to mandate I should make $1 billion a year. I can mandate that all day long, but it doesn't make it so. And so it's interesting. There was an article that I think it came out just yesterday, Mark. Let's see if I can find it here. But basically, senators are starting to get wise to the fact that this is wrong-headed, and they probably need to just eliminate it. Yeah, here it is. CMS blocking nursing home staffing mandate. Senators are getting behind it. It's gaining steam among senators. And so mandating staffing ratios is not going to fix the fact that the volume of people that need care does not match the volume of people that exist today and are projected to exist. And then there's some interesting challenges in the nursing schools and the med schools that are cranking out our healthcare workers, that there's a huge bottleneck there. And then you get some really screwed up stuff like you've highlighted in past months, Mark, of where literally fraudulent nursing diplomas were being issued. So that's my next category on staffing. Now, third category or a fourth category that keeps coming out, I'll just call it implications or maybe warning signs to hospice reimbursement. Some are good, some are not so good. And so concurrent hospice care improves quality and reduces cost. So I think that's kind of an indication of maybe eventually do we get a concurrent care model. Hospice industry groups are lobbying Congress to change CMS's special focus program. That is concerning what got passed as far as the SFP, because of it could take some people doing good work and then put them on this special focus program, and it's not a place that you want to be. So that could certainly, God forbid, someone doing good work and you end up on that, you could get frequent surveys, and if you don't pass that survey, your Medicare license could be revoked. That's what we're talking about here, kind of like game over type stuff. Value-based payment models are driving nonprofit hospice affiliations, which we'll get to one of the few other categories that you call out as well, which is mergers and acquisitions. We're seeing a lot more of that. all Medicare beneficiaries and ACOs could impact home-based care providers. We have a show coming out later this month with Bob Tavares on accountability care and accountability care organizations. Daily industry still in shock following the release of the home health final rule, which had that SMFP. Medicare's end-of-life model offers a promise for care and savings. So that's kind of on the positive side. There's been some interesting studies we've highlighted this year, like the NORC study, the I forget the other acronym. It's like the Niebrook study. I know I'm not getting it right, but they actually showed significant savings in hospice and palliative care. And NEBR study, that's the one I'm forgetting, NEBR study. And actually, even with very long length of stay Alzheimer's patients, that study showed some pretty significant savings. So that's my fourth category. My next category, I kind of call this one warning signs on the dashboard that we just got to pay attention to. And so hospital CFO report, hospital margins, interestingly, this one are holding steady, which is a little bit better than what we're reporting most of the rest of this year. We're going in the opposite direction. This one says, not a viable industry in any way. Nursing home operators raise the alarm, which is what you're alluding to. This next one, healthcare bankruptcies are rising. Here are 5 major filings so far in 2023. That was pretty eye-opening. This next one, pharmacy deserts are putting the health risk of Black and Latino Americans at risk as we're getting more and more of these deserts, pharmacy deserts. Nonprofit hospitals' financial outlook slightly upgraded for 2024. And so we'll see if that actually holds true into next year. Skilled nursing occupancy tops 82% for the first time since April of 2020. So that one's a little bit on the positive side. So I guess if I would summarize this kind of lights on the dashboard, is kind of some mixed signals in this month. Rural hospitals in crisis mode. So that would balance. And then the next one I put in this category, you cited already, Mark, which is the ballad health. And then really kind of calling out this, it's really a sanctioned monopoly is what it is. And now that they're going back and looking at data, that monopoly is not working out so well based upon the quality data measures, et cetera. All right, this next category I'm starting to call kind of demographic trends. It's like one is like the lights on the dashboard of the people providing healthcare. This is more where the trends of what we're seeing, where things are going. And there are a lot of interesting articles I put in this category more. Caring for aging parents doesn't have to be this hard. You called that one out. You think you're prepared to care for an aging parent? Think again. Elder care is a problem growing more urgent by the day. Despite rent hikes, senior living communities have become more affordable than other residential options. That one was kind of eye-opening. Why long-term care health insurance falls short for so many people. And then caregiving comes with a lower death risk, but higher financial cost. They had an interesting article about enhancing dementia care, and the new empowering caregivers is basically called the guide model. I put that because why that's coming out is because the huge forecasted trend of more people living with Alzheimer's and dementia. How family caregivers navigate the extra cost of tending to loved ones. There was a Kaiser family, a KFF article, facing financial ruin as costs soar for elder care. This was an interesting one. U.S. life expectancy climbs in 2022 after the COVID retreat. So after that retraction, now life expectancy going back a little bit. And then a New York Times article, when the neighbors are all older too. I found some interesting demographic stuff in there. And then the last one was nursing home care continues to outpace most categories of national health spending. So I baked all that into interesting kind of demographic trends, et cetera. The next category, Mark, I actually call it basically my innovation category, if you will, just trying to keep an eye on some interesting innovation. Auburn University receives a grant to expand telehealth services across all of rural Alabama. So that's kind of an encouraging innovation. This one was interesting. Maybe you, after I get through it, Mark, if you got a comment on it. Amazon once inspired fear in the healthcare industry, but no longer. I thought that was an interesting article. United Church Home CEO on the future of managed care and said, fighting the market is not a winning strategy was the subtitle of that article. And then this is one that jumped out at me. I did put that under innovation because I was kind of like, damn, I wish I'd have thought of that. The United Arab Emirates, UAE's first community-powered hospice to boost palliative care in Abu Dhabi. And I thought, that's actually pretty smart. Cleveland Clinic was one of the first ones to kind of diversify and become a global healthcare provider. I've never seen the data on what their margins are out of there compared to their American healthcare markets, but my guess is that's a diversification strategy someone's looking at. Also under innovation, new VR training model helps teach palliative care providers jolly good communication skills. There's some really interesting stuff that now that I keep seeing these articles on VR, talk to a peer who's writing a book. We might even have them on a podcast next year. Mark, you may know this. They're prescribing VR in lieu of opioid medications and getting good outcomes, which is just fascinating to me. Providers are hitting obstacles to scaling palliative care, but in that article, there's some interesting innovations. And last was just art therapy program using AI, artificial intelligence, generated images. So that was my innovation category. Then my seventh category, I just won't call these out, but there's just a lot of articles on Medicare Advantage, as you know. Maybe one of them I will actually call out, because Papa was one that we highlighted early as an innovation. Papa started in South Florida. It's kind of an Uber meets caregiver type service, but Papa is slated to lose dozen more customers. It became a darling of Medicare Advantage plans, but all of a sudden it's hit a lot of interesting challenges. So I'll put that under the MA category.
Thank you to our TCN Talks sponsor, Delta Care RX. Delta Care RX is also the title sponsor for our May and November 2023 Leadership Immersion courses. Delta Care RX is primarily known as a national hospice, PBM, and prescription mail order company. Delta Care RX is a premier vendor of TCN and provides not only pharmaceutical care, but also niche software innovations that save their customers time, stress, and money. Thank you, Delta Care RX, for all the great work you do in end-of-life and serious illness care.
My next category is basically all related to basically the mergers and acquisitions category. Forbes, who really owns nursing homes and how the feds are about to learn a whole lot more. And so the government is really pushing on the private equity ownership of nursing homes and kind of picking on that as part of the problem. And it's interesting. I talked to someone about this just this past week, Mark, and actually has grown up. Their family owned a bunch of nursing homes. And he said the challenge is that, okay, let's say they say bad business. They just go incorporate somewhere else. And so it's kind of like you push the balloon, they come out somewhere else. And so how do you really prevent that? American system is a capitalistic system. And can they really prevent that, or is this all grandstanding? So that was kind of interesting. Modern healthcare article under mergers and acquisitions, CMS rule could prompt private equity and REITs to sell nursing homes. Modern healthcare, Cigna and Humana are in talks. After I saw that, Mark, it's like, man, that was almost predictable. I imagine if I was Humana and Cigna, I'm looking at United thinking, well, how are we going to compete with United? And so do Cigna and Humana merge, and does that pass the whole,
Right.
antitrust and all that sort of stuff? Of course, on this category, I put NHC and NHPCO as well. The Virginia ones that you called out also. And then my last category almost became a catch-all. I'm kind of leaving it as my flexible category and just put some stuff that's interesting. And so, but this was about the pharmacy desert. CVS pharmacists are at a breaking point, imperiling companies' reinvention plans. And so, I actually spent some time on that last month. If our users didn't listen to it, I strongly advise you to go back. We got some really good discussion around what's going on with pharmacies. But there are two more articles. Virginia pharmacies say low reimbursement rates keep them struggling. And then a Washington Post article, which really kind of reiterate what you and I talked about last month, about the U.S. pharmacy industry is crumbling. But then also in this kind of catch-all category, many Americans with dementia can't get the hospice care they need. Something that I'm just wrestling with, and I think I need to do a couple more shows on Alzheimer's and dementia, Mark. Is hospice the best model for dementia and Alzheimer's care? And you've got the Niebuhr study says we save a lot of money. There's a line from my podcast, Mark, with Joan Tino that just was like a brain tattoo. And she said the challenge of Alzheimer's and dementia patients is the decline is by inches. And I think that is what makes it hard to fit within the hospice and palliative care model. I'm not saying it's not the right model, but it's at least worth some discussion with some really smart people. And let's see. And the last one, our dear friend, Carol Fisher, who's had best in the United States, #1 rated podcast in the UK and the United States about domestic violence called The Girlfriends. Well, an interesting article. Carol's like now pairing her two loves. She spent most of her career in hospice and palliative care, but now this wildly successful, almost unexpected podcast. So the article was A Silent Epidemic, Domestic Violence and Trauma Among Hospice Patients and Staff. And it's interesting because I've got a couple of team members that have been super just passionate about trauma-informed workplaces. And we've been bringing a lot of tools to the hospices we work with, but for their teams to basically have mental and emotional health tools. But then Carol's actually shedding the light on the people we're caring for. Many of them have experienced horrible stress and trauma in their lives via domestic abuse. And then you get the confluence of that at the end of life. And what do you do about that? And so it'd be interesting to see kind of how Carol kind of pairs this platform that she's kind of almost stumbled into as we go forward. So those were all mine, Mark. And I had no honorable mention, but thank you. You actually highlighted the release of my new book, The Anatomy of Leadership. It's available now on Amazon. So that's the only one I kind of put an honorable mention this month because everything else fit into those categories.
Great.
Any comments on any of those articles?
Well, I think on dementia issues, something that's starting to get a little attention, and is hospice the right form of care or model of care? But the other half, you have the patient, but then you have the caregiver, and the impact on the caregiver. If the caregiver is a son or daughter who is still in the workforce, the impact on their ability to continue in their employment and continue to make money, or do they have to take early retirement or a years-long leave and deplete their savings? Then you have the mental, physical, emotional impact on the caregivers. So, the advantage that hospice has is it's a model of care that incorporates the entire family, everybody who's part of the patient's life. And that's probably the right direction to go. I don't know if it's the right model, but it has to be part of the direction that we go when we figure out what to do with the best way to provide dementia care. It has to incorporate the caregivers at home or it will fail.
That is very well said. And the interesting challenge, actually, I've had a family situation, my godfather, and so my aunt is going through dementia, Alzheimer's, and there are substandard hospices out there. And the first thing of healthcare is first do no harm. If you do not know what you're doing from a pharmacotherapy standpoint, you could actually create a worse situation. And so it's not a no-brainer in how you clinically provide. But God knows most of the actual support of the care model is absolutely to the caregiver. And so I think it's worth a discussion of some really smart people. The good thing about the CMMI article about the guide model coming out, it actually is keeping the caregiver in mind and is actually going much further upstream with an opportunity to partner with home-based primary care, palliative care. The interesting thing we're kind of journeying right now is, could you take some of the excess capacity in hospice inpatient units, because there's a respite benefit in this guide model, and utilize. But then quite often, right, innovation doesn't square with regulations. So would that create legislative or just licensure issues with hospice inpatient units? Well, Mark, before we go,
I just want to jump in on that too. I think the issue is going to get more play, at least in December, because of what Chevrolet has done. They produced in-house, by the way, without an ad agency, an incredibly moving 5 minute and 20 some odd second commercial about a family at the holidays where the matriarch of the family has dementia, and what a granddaughter does to give her a good day. And you can't watch that commercial without getting emotional at best or crying.
Yeah, I know. When I saw it, Mark, I thought, that's a hospice mission moment is what it felt like.
Yeah, and and that ad is so well done, and it moves so many people that at least in the dementia care, post-acute care, end-of-life care segments of social media, it is blowing up the internet. And I think that's a good thing in this case. So that way, it's things like that help move the needle on a question like, what do we do about dementia care?
Yeah, that's great, Mark. Well, Mark, before we go, I definitely want to, first off, I want to thank you. I have such a deep appreciation for you and what you've done in hospice news today. Waking up 4 and 3 o'clock in the morning to produce a service to hospice and palliative care leaders. And so thank you. You are
welcome.
segueing and you've got a plan. And the cool thing is you're not going to keep doing these podcasts in the next year, but you want to talk about what your plan is?
Yeah, sure. It was a fun year to talk about media coverage in hospice, and I appreciate the opportunity to spend this time with you every month. I've been publishing Hospice News Today in one form or another since October of 2012, and it's a labor of love, but it is a labor. And I've decided to scale back, and so I announced a year ago that I was going to cease publication. And about a half a dozen parties contacted me, some more serious than others, about what it would take to pick it up. And the winner of the sweepstakes was Court Kastner, PhD, the brains and the number cruncher behind hospice analytics. He was one of my first paid subscribers to Hospice News Today, been a fan for a long time. And he's figured out a way to move the newsletter forward. It will change. It will evolve. The subscription model will change, but I'm excited about his plans for it. He's been incredibly thoughtful. We've been working behind the scenes really since about September, maybe even late August on this transition. And come January 1, he will become the publisher of what he's going to call Hospice and Palliative Care News Today. It's going to be both a newsletter and a website. He'll be bringing on an editor who will be named in another week or two. And I think it'll be exciting for folks. I think the readership will expand because of the way he's going to handle the subscription model. And for me, I get back 6 to 8 hours a day 7 days a week. So I'm looking forward to continuing to doing my work of providing strategic communications consulting to a handful of hospice providers and a couple of vendors who serve mostly not-for-profit hospice providers. Wouldn't mind picking up another couple clients, given the extra time I'll have. But
and that would be like getting master class all the time. So just a plug for Mark on that.
And you know what a lot of people do is they hire me to mentor the young a communicator who's the sole communicator on their staff. And that's a lot of fun for me. And it's always a learning experience for the 25-year-old that I'm working with. And we have an impact on the public image and the public messaging of the hospice providers when we do that almost immediately. So it's high impact and engaging and fun and something I look forward to continuing to do for several more years.
Well, my wife will not watch a movie if there's not a happy ending. And I feel like we have a cool happy ending as this is our last show of 23 because you've got a great plan. I love Court. Teleas is actually going to be partnering with Court in his newsletter. We're going to be one of the first advertisers in it. When I first knew that you were retiring, now you get to take your great work. It's going to evolve. It's going to be a new version. It's going to keep serving leaders. You get to keep doing your great work. You and I get to keep doing this wonderful podcast. It's all awesome. It's all a good happy ending.
I agree. It's great.
All right, Mark. Well, we appreciate you and thank you for your work that you continue to do and will continue to do. And thank you for your many years of service. And our listeners, we do thank you. This is Mark and I's final news story of the month, but we'll have a couple of other podcasts this month that we'll be releasing. And as we always do, I actually ran this quote by Mark, and this feels very appropriate. It's from one of my favorite leadership authors, John Maxwell. He says, a leader is one who knows the way, goes the way, and shows the way. Thanks for listening to TCN Talks.